All patients that I see are followed along with various specialists. There are informed consent forms. The conventional therapies are explained very carefully with complete objectivity. Most of these folks with cancer have been through the conventional system, and probably most of them are told to just go to hospice, that they're going to die. Nothing could be done. Most patients that I see are considered end stage in cancer. Well, most of us know about CAT scans. It's a radiological test that demonstrates anatomy. It shows an anatomical feature. PET scans demonstrate physiology. For cancer, a small amount of radioactive sugar is injected into a blood vessel. Since many cancers thrive on sugar, the radioactive molecule goes to the cancer first, and when you take a picture, it lights up on the screen like a Christmas tree light where the cancer is. Well, many insurance companies do not pay for PET scans, so in this case we can only do CAT scans. This is a slide that I borrowed from the Mayo Clinic. On this x-ray, this person actually has cancer, but with a regular x-ray it doesn't show up. With a PET scan, you could see these areas of early cancer with, they show up because sugar goes to the cancer, and the sugar is radioactively labeled. So you could see it much better than with a CAT scan. Well, there are many types of pancreatic cancer, and they differ in severity. Our first patient is Mrs. G.B., 74-year-old woman who's a patient at a large California medical center. I first saw her in September of '06. She had biopsy-proven pancreatic cancer. She told me that her religion does not allow standard medical treatment, and several of her friends have died from chemotherapy. Her doctors told her nothing could be done. My protocol, I combine low-dose naltrexone at bedtime with intravenous lipoic acid. All patients are prescribed a high green vegetable diet. Many are on several vitamin supplements and herbs. They should be on some type of exercise program. I like the sun. Sun tanning is fine, but not burning. And I prescribe some type of relaxation and good night's sleep. If they have trouble sleeping, I prescribe something that breaks this anxiety cycle like Ativan or Xanax. Probably about half of what I do is conventional standard medicine, and probably half is integrated medicine. The protocol is low-dose naltrexone, 3 to 4.5 milligrams at bedtime. When a person first comes in, we do intravenous alpha-lipoic acid, 100 to 600 milligrams IV for maybe a week or 2 weeks, and then every 3 to 6 months, depending on the patient. And I use our original National Institutes of Health protocol that Dr. Barter and I developed years ago. We want them to have a healthy lifestyle and nutrition program. We want them to be very adherent to the program. Mrs. G.B. was very adherent to the program and still is. Other people will talk about how naltrexone works. Most of us know the theory. A lipoic acid does many things. Probably the most important action of alpha-lipoic acid is that it's the rate-limiting factor for the production of energy from food. Food cannot get into your mitochondrion where it's burned for energy. It's converted to something called pyruvate. Pyruvate can't get into your cell. The fuel for the mitochondrion is acetyl coenzyme A. There's an enzyme complex called pyruvate dehydrogenase, but this does not work without the trigger, which is alpha-lipoic acid. When we're little kids, we produce plenty of lipoic acid. In our own bodies, as we get older, we produce less and less. If you feed a little child a Thanksgiving dinner, he has plenty of lipoic acid, he'll be running around the house afterwards. If you feed an 80-year-old man who produces very little lipoic acid in his cells, he'll be sleeping on the couch. If you give him some lipoic acid, he'll probably be walking around the house. A lipoic acid is also a free radical scavenger. It's an antioxidant cycler. In other words, when vitamin C and vitamin E and NADH and all of these things are used up, lipoic acid converts them back to the useful form. It's also the greatest generator of glutathione, which is the most important antioxidant in the body. And here's the lipoic acid. This is how it fits into this complex for the production of energy from your food. A very, very essential molecule. And many people in the anti-aging industry use it, especially in Europe, for anti-aging. It's a prescription drug in Europe. Here it's a nutraceutical. Well, this is Mrs. GB when she came in. Here's her liver, and her liver is full of metastases. And here is the cancer in her pancreas, full of cancer. This is September 06. In June of 07, the liver appears free of metastatic disease, and I don't see anything in the pancreas. This is just some of the contrast medium being pumped through the heart and accumulating in the bladder from the kidneys. This is March of 08. No sign of pancreatic cancer. Mrs. GB, September 06 to October 09. Feeling well, no signs or symptoms of cancer of the pancreas, more than 38 months following diagnosis. This case will be published with 2 other cases in December of 09.